All right, so one of the concerns with a workout like that and why I was so adamant that you come down quickly from the jumping pull-up is there are certain movements due to their range of motion and speed and the fact that sometimes the eccentric or the lowering can be accentuated, we now have an issue for rhabdo. And for anyone that doesn't know, rhabdomyolysis essentially refers to the muscle cell breaking down, the contents of the cell leaking into the bloodstream, those contents going into your kidneys, causing blockages in your kidneys, which then cause potential renal problems and or heart arrhythmias due to electrolyte imbalances, and it can kill you. Now, I don't want to scare anyone and say CrossFit can kill you, but if left untreated and not know what to look for, it can be pretty bothersome. So, what is it? I just told you. What are the symptoms? The symptoms would be nausea, vomiting, muscle cramps, abdominal cramps, extreme muscle soreness, and the telltale sign is if you pee and it looks like Coca-Cola. So if you've got brown pee that looks like Coca-Cola, immediately go to the hospital. Do not fuck around with this. I'm not kidding at all. I'm dead serious with this. If you ever have a situation where you work out here and the next day you go to the bathroom and the pee is brown, immediately go to the ER. Because you do not want to have a heart arrhythmia that kills you. I like you all. Hope you like being here. I don't want to get you hurt. So, how is it treated? If you go to the hospital and they figure out you do have elevated levels of CPK, which is the test they'll do for it, in addition to like just seeing that your pee is brown, they're going to hook you up to an IV, and it's just going to help essentially dilute the myoglobulin out of your bloodstream. So basically pump you full of electrolytes via an IV, and you'll be through it. Now, will you have some severe soreness for a couple days afterwards? Sure, you absolutely will, but you won't die. And that's my job to kind of make sure you guys understand what it is and why you should care about it. Now, how do you avoid this? Well, one, we're very deliberate with our technique, right? We say come down fast, so you're not exaggerating the lowering of the movement. Two, we build you up at the right intensity. That's the reason why there's a beginner's class before you come into class and why you come into class for the first few months. After the beginner's class, we keep the intensity on the lower side or scale things back. It's to better prepare you for the volume and intensity in these workouts. And then last but not least, it's just making sure that we hydrate well, we eat well, we sleep well, and we avoid alcohol. So if you ever go on a bender, don't come here the next day. You want to know the surefire way? You know, you hear a lot of reports of like college sports teams getting rhabdo. You hear like the Tufts lacrosse team got it doing CrossFit last year. Well, some of that was the programming of what they did, but also like, I remember what I did in college, which was drink every single night, and then who the fuck cares the next day? I'm going to do whatever I have to do anyways, right? So alcohol can be one of those big things you want to avoid when it comes to preventing rhabdomyolysis. So biggest thing here is, and what I'm trying to get across is if you come here and the next day you have intense soreness and brown pee, go to the hospital immediately. Get it taken care of. It's happened here before. We've had a couple cases of it, no one's serious. A lot of them still come here. Actually, all but one comes here still. Yes, Jake?
What if we have 2-day intense soreness from doing 150 wall balls?
You peeing brown?
I don't think so.
I don't care. Yeah, well, so in that situation, that might be Little Caesar's diet, some less Monster energy drinks.
I don't drink Monster.
C4? Ghost. Prime. Are they all the same thing? I don't actually know. I don't either. Yes. I don't know. It's an energy drink. It's all right. You can ask questions. I don't know what it is. I don't drink that stuff. I like coffee. Any questions, guys? I don't want to scare anybody, but like again, if you wake up tomorrow and you have intense soreness and you have brown pee, go to the ER. They'll take care of you. It won't be a life-threatening condition if you get it taken care of, but if you don't get it taken care of, it can be. Cool? Guys, thanks for coming in. Don't rush out of here. If you got some extra time, wouldn't hurt to stretch a bit more. I'm sure your lats are probably feeling that a bit, but thanks for coming in, guys, and I'll see you all tomorrow. It's Power Snatch Day tomorrow. Heavy day.